Hello, this is Ben Amick, and I'd like to talk to you today about how a life course perspective challenges us to think differently about work and health. First, you may wonder what a life course perspective is. And this picture or figure from a European Union report on mental capital and well-being shows you a very classic picture that's being used today to look at the broad determinants of health. You can see that on the left side they have the biology of mental capital, the people involved in mental capital, the mental capital itself, such as decision-making, cognitive resilience, cognitive reserve, culture and environment. And on the very bottom, what you see is the life course. And the life course is represented very simply here by a very large black arrow and some words: school, work, retirement. And below that, early childhood, child, adolescent, adulthood, and older people. And then it's describing the processes for the acquisition of mental capital, transitions, maintenance, and decline of mental capital. So the life course perspective is really a focus on the total life course of an individual, whereas typically in work and health research, we are focused on work and workplace hazards and exposures, or work-family balance. We are typically not focused on childhood or adolescence or retirement. More recently, we have focused on work to retirement transitions in more detail, but again, that's been a limited life course perspective. So why do we care about a life course perspective? Well, we really want to help workers participate in work and to extend working life in good health. And this is a real challenge for us because today we have a lot more people with chronic health problems working in the workplace. Life expectancy is increasing, but people are working longer, sicker, and often in the United States without health care. We have rapidly changing work and labor markets. We're going to be talking about that in more detail later and the challenges that presents to us. But the world of work is fundamentally changing. We've moved to the gig economy. We've moved to a global economy. We're now moving to the COVID-19 economy. And everything is changing now. Yet at the same time, we still are sustaining the same socioeconomic gradients that we've always had in health. They may be becoming exacerbated by COVID-19. What we need to do is think differently. The research challenges us to think differently when we think about a life course research. So why do we need to think differently? Well, current work and health research is very fragmented. People study a piece of it here, a piece of it there, a single exposure that they link to mortality 30 years later. And so what we have is fragmented research with a focus on jobs, exposure, work organization or employment contracts. I've referenced Berkman here in the social epidemiology textbook, but there are many pieces out there that are looking at those things, yet we don't bundle them all together and bundle them into a life course. And we come to the conclusion that traditional occupational or psychosocial epidemiology research is no longer sufficient. It really does not allow us to capture the important impacts of pre-work conditions. How do we accumulate advantage or disadvantage over the working life? What's the interplay of work and health? How do we look at the impact of health, work and health on retirement? All of these are issues that they're fragmented and we really don't have a language for them. And unfortunately, Health disparities does not really provide that language. It calls attention to the multiple levels that are important to consider, but it does not force us to take the broad view of looking at the life course and the implications of that for doing work and health research. And finally, as I've said once, and I'll say multiple times, we really have to struggle now with what the implications of this all are for post-COVID-19 work and labor markets. The pandemic is foundationally changing how we think about work and health. So let's continue to help people and to get a clear vision of this, what I'm talking about. So here we have a very simple picture that shows the working life and the non-working life during adulthood, and then childhood and retirement. And a working life course captures all this dimensionality in doing work. And it's important to recognize that even during the working life, people are not working, and there are important elements of the non-working life that affect their working life, and vice versa. So what I'd like to do now is to take a step back in time and quickly acknowledge that some of the main themes in life course research emerged from sociology and psychology and aging research in both, but also developmental research in both. It also is an important component of demography. It wasn't really residing in public health or in occupational safety and health per se, except to the extent that researchers were using a LifeCourse perspective to examine developmental issues in childhood and adolescence. But even there, for us, it's not really important. But here are 4 key themes, and we won't spend a lot of time talking about them, but I think it's important to understand them. And they are that lives exist in time and place. This is a very simple idea, but you can't decontextualize the working life. As much as we want to in science, somebody who grew up during the recession in Oklahoma in the Depression, in Oklahoma, is different than somebody who grew up in New York City during the Depression. Somebody who grew up in Canada during the 2009 recession is different than somebody that grew up in the United States, who is different than somebody who grew up in Finland. Place matters. There are social supports that matter, and there are timing of things that matter. We can even start to think of the impact of this on the new generation of people coming out of education and how they're going to think about work in the COVID-19 world. I think we're going to have a whole new cohort. The second theme is human agency and its constraints. People are agents. They're active agents in their life course, and we put constraints on them. Those constraints can be related to a lot of different things, but the simplest way to think about them is not everybody has the same opportunities. We also can, through multiple impacts on an individual, affect their felt human agency. So people may not feel they have the ability to do some things that other people have the ability to do. And that's very important. The timing of lives. It matters whether simply you get pregnant when you're 15 or whether you get pregnant when you're 25 or whether you get pregnant when you're 35. That's a simple example, but not a complicated example. And finally, the interdependence of life. I've already talked about that, but another way to think about this is that each of us who's in some sort of a committed relationship, our lives are interdependent. If we have kids, they become further interdependent. And what we do and how we do it depends on that interdependence. It's not simply an individual's activities. And we often deconstruct that interdependence in how we model things, and that's a mistake that we need to think through. So this is going to be how I end with kind of the basics of LifeCourse research. Now I'm going to get into it directly as it relates to work and health. And I'm going to draw heavily upon a piece that I co-wrote with Chris McLeod and Uta Bultmann. Those are my two amigos who have been working with me and thinking with this on me for the past 5 years. This is an easy piece to get if you're interested. It's an open pub, so you can pull it down easily. And I'm going to return to this many times. So what are the key LifeCourse concepts in epidemiology? So there are 4 key LifeCourse concepts in epidemiology. These are even referred to as LifeCourse epidemiology principles. They come out of a research group in England headed by Ben Shlomo and Koo many years ago. There are many articles out there on them. You can look up those 2 names and find anything you need. We reference them in our piece. But the 4 key concepts are there are sensitive or critical periods in a person's life course during which exposures are more significant than they are in other times. The second is that there's an accumulation of risk over the life course or change of risk over the life course that lead to cumulative advantage or disadvantage that have an impact on health. Third, there are transitions, and transitions can be from school to work, from working to not working. They can be health transitions. They can be retirement transitions. These are all types of transitions. And then the fourth is that all of these come together to create trajectories. And in LifeCourse research, we make the assumption that there are patterns of trajectories that exist in life that allow us as scientists to look at these normative patterns and therefore see critical periods or observe accumulation of risk. So to better understand or to better ground our thinking on LifeCourse, integrating LifeCourse epidemiology, let's work from a picture of somebody. So this is in the paper, so if you want to get the paper and follow, you can. But let's look at this individual. This individual has had multiple health status transitions. They've had multiple life course transitions. They've had labor market experiences, and they've had labor market transitions. And so you can see that they start off, this person early in life is depressed. They have depression. The depression may be part of the reason they drop out of high school. Not having a high school degree may be a reason they're unemployed, looking for work. That is a labor market status or a labor market experience. They could then become employed. That's a transition. But they could be working in a poor job with poor pay. So it could have, could be very hazardous with low pay. So that's a labor market experience, different than being unemployed, which is another labor market experience. That person could, because they're in that type of job, transition to work disability, which is a health status transition. They could then decide they're not going to look for work anymore, which is another type of labor market experience. They're exiting the labor market. They could then have disability retirement at an early age. They could apply for disability pension and therefore have another transition. And then they could have poor health in retirement, which is another health status transition. So this shows you how when we start to look at a LifeCourse perspective, there are complex interplay between various elements. And these are the constituent elements that we like to talk about. Others will talk about them differently. I would hope over time that we can reach some common language. I think that's going to be important because we need to be able to to synthesize the evidence, and to the degree that everybody's using different language, it creates big problems with evidence synthesis, and we really can't learn what we need to learn. So that's the example. So what is a sensitive critical period? They're usually periods early in life and during working life where the exposure is having a significant impact on health or on working life. They're the periods that we're looking for in the model where we can intervene. We don't know where it is in this model. It could be that if we intervened early in life and addressed mental health problems, that would have changed this whole trajectory. But we don't know because that science has not been done. So let me give you one example of working life course research that perhaps can give you some insights into why this is a valuable way to think about life course research. This is a study that was led by Karen Veldman from the University Medical College in Groningen. This is a research group that I'm now working with, and obviously Dr. Bultmann is a leader of this research group, so it's a small network. And this is a study of mental health trajectories from childhood to young adulthood and how they affect educational and employment status of young adults. So this is studying only one piece of a very broad working life, and it may be that much of our research will have to be more segmented and try to build upon each other, because we typically don't have data sets that start early and have multiple data points that go into retirement. TRAILS is a longitudinal study of youth that have transitioned into adulthood. Again, you can look up the details in the paper. I'm going to describe pieces of it here just to illustrate a sensitive critical period. So they were basically interested in looking at people who were at school or at work with basic educational level, or neither in education, employment, or training. So these are people that are disengaged. So you have people that are in school or at work with a basic education level, or they're basically disengaged. They followed people from 11 to 19 years old. So again, this is a particular segment of the workforce. Many kids will still be in college. But you can see there are, but this is a classic way that life course research is presented. It's typically presented as trajectories. These are latent growth curves. So you can see that there are people that are characterized as high stable and low stable. You get a percentage of the population that's in those groups. And then you ask the question, these are the problems, the mental health problems that people have. So you've got people that have a high number of problems who are stable over time, and low problems who are stable over time. And you can see that problems have been broken out into total problems, internalizing problems, externalizing problems, and then attention problems. These are the three mental health measures in the TRAILS study. This just shows you again in one picture total problems so that you can see it. And you see the borderline range there. That's identifying when things are more clinically meaningful. I'm not going to say clinically significant. They're just more clinically meaningful. But you can see here that you've got basically 4 groups. So what do we learn from understanding these trajectories? So it turns out that young adults with high stable trajectories of total problems were more likely to work without basic education level. So they didn't have basic education, or be in this not in education, employment, or training at age 19 than to be at school or work with basic education level. So those are the high-risk people. It turns out that when you look at it and separate it by the different types of problems, it's mostly people with externalizing problems, not internalizing and attention problems. So what would we conclude from this, and what are the implications? We would conclude that adolescence is a key developmental or critical period that should be linked to later life labor market outcomes. Now, I will add here that unfortunately, the way that the research was presented, which was very good, we don't know about the timing and duration. Does it matter whether the person has these problems early in adolescence or late in adolescence? And how long does it matter? These are important dimensions of this that we all need to worry about, that perhaps we haven't worried about as much as we should. It also says that early detection and treatment is needed to ensure smooth transitions into the labor market. So as I suggested in the picture, maybe dealing with depression early is important. And of course, it raises this awareness about history of mental health and later life work outcomes for healthcare professionals. Okay. So that's an example of how we can use a LifeCourse epidemiology perspective to identify critical periods. And this is a very good example of that. And it presents, I think, for many of us a real challenge, because often we do not have the data to look at these earlier periods of life where we know health issues are affecting education and the types of jobs that people get. So the second principle of LifeCourse epidemiology is that we should be studying the accumulation of health risk or advantage over time. How do we accumulate risk year after year of working in poor working conditions to create cumulative disadvantage, or in good working conditions to create cumulative advantage? We know that these are distinct by some level of social structure. And here, timing and duration of work exposures matter, and also health exposures. I'm going to let you think about this and ponder this for a minute. And if you look at the labor market experiences in that picture, how would we accumulate those? Different research has done different things. I've seen research that's basically had 5 years of data and they've just taken the average of that data. People often will try to describe the data, particularly when they're looking at employed conditions and unemployed conditions. I will show you examples of that. But it's a real challenge. This is one of the foundational challenges of what we are doing, and we have yet to really solve this challenge. So I'm going to present to you work that I've been involved in. There's a lot out there now, or more out there now, not a lot. And this is from a paper that I did in 2002 and from a chapter that I wrote in 2000, that both were database chapters, databased. So let's return to our LifeCourse description in a different way. This is a more classic way to think about the problems of a dynamic cohort. If you're doing research and you're following people over time, in this case, I was following people who were employed in 1970 through 1990 and then looking at mortality. So I was trying to describe that exposure window between 1970 and 1990. Now, for the person that's described in the top of this picture, clearly their working life started well before I started looking at them and ended before the end of the window. The second person, their working life started before, but then they weren't at work then for a long time. So were they out of work? Was it a person who got married and then took care of kids and then decided to go back to work and then they died? So, or was it a person that we followed, the third person we follow, and they have gaps as well, but we don't know when they died. So that's a person who's left censored or right censored. You can see that we can do multiple combinations of this, and this is the reality of a dynamic cohort, which we often have. We don't know when the first job is, and we don't know when the final job is. In a perfect world, we have the person at the bottom, which is we know their first job and we know their final job. And we can model that the accumulation of exposure over that life course, over that working life course. So how do you do that? That's a big challenge. We struggled with it in our work looking at the panel study for income dynamics, which is where this research is from. Again, you can read it in much more detail in the psychosomatic medicine paper. But 5-year latent lag, sorry. But we also looked at 10 years. And what I will tell you is we don't see really significant results. So we would establish our exposure, then accumulate deaths, and look at the relationship between exposure and deaths. But that gives you an example, and it's an in-depth example, and I apologize for going deeply here, of how the challenge of accumulating exposures over the working life. So I'm going to share with you a couple of more examples because I think they're all important. So here's an example from a paper that Jonathan Fan led, looking at labor market and health trajectories during a period of economic recession and expansion in the US from 1988 to 2011. And what you can see is here we were looking at these employed, unemployed, inactive transitions. And this is another way to do it, which I call the brute force method, where you just basically look at the data and you look at the main categories of the data, and then you describe those trajectories. Then you link people into those trajectories, and then you relate those trajectories to health. He used the panel study for income dynamics as well. This is an interesting paper. This is another paper by, again, Peggy McDonough. And you can see how she and her colleagues described labor market, late life labor market. And it's everybody makes their choice about how they're going to describe it. There isn't a consistent way to do this yet. Some people use this, descriptive brute force method. Others, like the research group in Barcelona, of which Dr. Delclos is a part, describe it using latent growth models. So it's a more empirical characterization of the working life trajectories. This is interesting because it's people born in 58 to 65 and from 81 to 2013. And you can see the trajectories here. This is an empirically driven model of how to describe trajectories of employment. Of course, each of these is challenged by the fact that it would be better to have some sort of underlying conceptual framework for why different trajectories affect health. We found in our research that if you have in your cumulative working life, basically, if you're in jobs that have low control, you're at significantly increased risk of mortality compared to jobs with high control. That holds whether you're in you use a 10-year mortality lag or a 5-year mortality lag. And you can see we've adjusted for a boatload of things at the bottom of this. I'll show you that full figure further on. But as you can see, this is a very, very interesting picture and model. But again, we got these results using a accumulation of exposure model. So let's move to the third basic principle of LifeCourse epidemiology, which is work-life transitions. So transitions are changes in states that people have. They're typically constructed by the social context. They're often school to work, changing careers, getting unemployed, things like that. Those are the ones that we describe in this picture. Again, returning to the picture. But the thing about transitions is they're really not simple. They're very heterogeneous. There are often significant changes in physiological, psychological, social, and material states. There can be multiple transitions between different labor market experiences and health states. And the working life course is framed by school to work transition at the front end and work to retirement transitions at the back end. So transitions are a core element of building trajectories. We need to understand them better than we understand them now. We don't really understand them very well. More research is needed, both quantitative and qualitative. But here's an overview of labor market and health transitions. So let's again return to the panel study of income dynamics and the research that we did at the beginning of this century. And what I want to call you, these are the models that we looked at, excluding the psychosocial exposure measures. So these are all the covariates that were introduced into the models. And what I want to call your attention to is the fact that there's an interaction between age and retirement. Turns out that age is bad for you, but retirement is good for you, for your mortality. And there's an interaction, it's protective. But really, the interaction is much more complex than this. And what's really happening here is that people that aren't healthy are retiring earlier and therefore are experiencing health problems that eventually lead to their death. Unfortunately, we didn't have a big enough sample to look at more interactions. But as you can see, if you go to the paper, we offer a lot of explanations for why we think these findings exist. But it's important to realize that we have this normative conceptualization of retirement as 65. And that's not what happens in the life course. The panel study is a representative sample of US households, and really people are retiring much earlier than 65. Some people unfortunately aren't retiring until 75 because they have to work. But again, that's another side of the retirement spectrum, which in the new normal of COVID-19 may be what we see. But this is the old model. I also wanted to put a picture in here from something that we were interested in whether people that start their work in jobs that are described as underutilization of skills move to a good skill match or whether they go the other way. And what you'll see here is that Black men tend to go the wrong way. They're at risk. They're going from good skill match to underutilization. And we know that that leads to disengagement, it leads to alienation, it leads to a wide range of healthcare, service utilization issues, mental health issues, as well as physical health issues. And you can see that Black females are indifferent across them, but you can see the advantage to white, to non-black males. So this just shows you that what happens over careers is unequal, it's complex, and it's also socially structured. And we'll get back to this later. We're not going to spend a lot of time on this now, but in the context of the United States and COVID-19 and the observed disparities between blacks and non-blacks in terms of who dies, I think it's important to understand that this is unequal over the life course, and we should be attending to this. So the final principle in life course EPI is building working life trajectories. And this is where you take these different pieces and bundle them together into a formal trajectory. So there isn't a single thing, but you now describe the full trajectory for the working life. So I'm going to talk a little bit more about these transitions, trajectories, and social context. And then I'm going to move over to social context for a minute, and then talk a little bit about where I think some of the issues are in the future. So transitions, trajectories, and the social context. The nature and timing of work-life transitions are constructed by the social context. I think that's really important to understand. It's a very dangerous thing to decontextualize work-life transitions. A series of work-life transitions and work experiences together create the working life trajectory. It's not one or the other, it's both. And this is one of our challenges, which is how do we bundle these and build them together? This is one of the great challenges. I do believe that this is not a methodological challenge as much as it is a conceptual challenge and a data availability challenge. We just don't have a lot of data that lets us look at this. I think the third thing is political changes in the global economy change the social context, and that affects labor markets that affect work transitions, and work experiences. We all know this. It's important, but I think they matter more than they used to. And as somebody who has recently moved from Miami, Florida to Little Rock, Arkansas, I can tell you that they're very different labor markets, and very different political environments, and it does affect work and transitions. So I'm going to spend a little time talking about social context. I know another person is talking about that here, but it's what I just said. Political changes in the global economy change the social context, and that affects labor markets, e.g. the dynamic multiple transitions. And you can see here in our picture, we've now added social context. If a person drops out of high school and has limited job training opportunities, then that's a problem versus somebody who drops out and lives in an area where they have great job training opportunities. If a person gets trained and then is looking for a job and there are no good jobs available, then we have a problem. And I think that's going to be one of the big problems we have now. If a person works in a job that may in fact affect their health, and there's no good disability management programs, that may lead them to transition out of work into work disability. Alternatively, that could be a positive thing, and somebody who's working and is intent and there's good disability programs, and they transition to them, that could rehab them and get them back to work. This is a major issue with COVID-19. I again return to it. but we don't really have any good models for how we return people to work. And then there could be limited disability pensions, job retraining, or job prospects for persons with disabilities, and that can just lead to them just saying, yeah, I'm done. I'm just going to retire, take my disability pension that I have and my Social Security in the United States and other countries that may be a little different, and just live my life. But those are all social contexts that are contributing to and affecting transitions and labor market experiences that you're trying to bundle together. And this is the challenge we have. This is why it's people don't do this work, because it's hard. But I think the time has come that we have to confront the difficulties and really start challenging ourselves to ask the questions how we build or take advantage of cohorts that exist, and how we start thinking through the complex interconnectedness that is a LifeCourse approach to work and health. These are the core social context levels that we describe in our paper. They're really at 3 levels. These are multi-level. There's the workplace organizational level. There's below that the labor market level. And then there's the societal level, and then the supranational level. And each of those is important. They're challenging and more challenging to understand in the context of our work, but we need to start thinking about how we can do these types of models in our research. So, in the end, we have an illustrative working life course. This is one person's working life course. I would challenge you to draw your working life course and use these words: health status transition, life course transition, labor market experience, labor market transition, health transition, and social context, and understand the differences in different social contexts. If you get married and have kids, that's a transition and that's a context, right? That's a non-working context. You now have formed a household. Household formation is critical in adult life. My world was a lot different when I had a daughter and was getting up at 4 a.m. to take her to ice skating. So, let's just spend a few seconds thinking about how we're going to move forward with this. And for me, it does all center around COVID-19 for most of us, because the pandemic has truly caused us to have to rethink what we're doing. And I think importantly, it has exacerbated fissures that already existed in society and, for example, created new problems in understanding life course work and health. I think that work will become more fragmented in the next few years and then over time as people struggle to find multiple jobs or to work at home and reorganize work. I feel that we're going to be moving back into a window of time that we were in the 1980s, where we were busily re-engineering the corporation, and we're going to rethink how we do work here. And it's not going to be about just building a gig economy. It's going to be really rethinking how many people do we need in a workplace and how do we do the work. And for some, there may be no differences, but I think work's going to become more fragmented, primarily because if people work at home, you have to be able to metricize what they're doing. I think these new cohorts of people graduating college or high school, they're going to see the world differently than past working cohorts, because Their job opportunities are going to be exceedingly limited. They're dealing with a pandemic now, so they're also worried about if they're going to get infected and sick. They're dealing with the fact that today they may not have jobs when they start, and therefore they may think about savings differently than other generations have thought about it. They may not think that it's important to own homes, much the same way that the millennials have moved in that direction. We may see a completely different way of viewing the world. And this is really about timing and place. Timing today in Arkansas is very different than timing today in South Florida. I think that we're going to see more working at home, and this is going to lead organizations to really think about how they can metricize performance, because one of the challenges in working at home is that you want to be able to make sure the person's still working the same number of hours. So we're going to see greater efforts to monitor what people do. I also think it's going to contribute to tremendous social isolation. We already know that's a problem, but this is going to be a bigger problem when somebody's essentially on the computer being monitored, working for 8 hours a day with no contact with anybody. We know that leads to mental health problems. We also know that that leads to physical health problems. I did not hypothesize it here, but I would hypothesize that this is going to not be equitably applied across all types of jobs. I think you will see people like us who won't have our performance metricized to the degree that somebody who, for example, works in billing in an organization will have their performance metricized. So again, I do think there are going to be constraints on some people that are going to be greater than constraints on other. And I don't think that's going to be equitable. I think we can all agree the global economy may not recover for years. And I think many young workers may have difficulty transitioning from school to work. This is a very simple thing, but we need to start studying this now because this is a huge issue, not a small issue. And it has impact. Early life unemployment, we know, has a significant impact on not only later life work, but early life mental health that can then affect, again, physical health. And we could end up with significant, what I would call cumulative disadvantage spirals over the working life course. Persons may delay marriage due to lack of resources. I think we'll see this. I don't think people are going to want to get married or are going to want to think about having kids early. We're going to see a lot of delayed marriage, and that has an impact on what people do and how people transition through the working life course. We know it differentially impacts women more than men, and that's really a challenge. I think we're going to see that older workers may be released or furloughed to manage cost. Older workers with more experience are often more expensive. And in today's environment where people are losing lots of money daily, one of the simple ways to manage cost is to furlough or release older workers. And I think this is going to be a significant issue. And I think those workers are going to have significant health problems. And we need to manage them and help them manage their mental health and their physical health as well. Okay, well, that's the last of my talks. I hope this has been interesting and provocative. I really didn't want to overwhelm you with data. I wanted to challenge you to think a different way about work and health research from a LifeCourse epidemiological perspective. These are my colleagues in crime. Uta Bultman and Chris McLeod are my amigos. John Lavis is an amigo too. A lot of this work was done in partnership with the Vici research group at UMCG in Groningen, the Netherlands, that Dr. Bultman leads, and at the Institute for Work and Health in Toronto, where both John Lavis and Chris McLeod were my colleagues. So thank you, and I hope you found this useful.